When Brent Cossey turned 40 last month, he never imagined he'd be eligible for the COVID-19 vaccine so soon.
I was thinking probably at the earliest in June. That's kind of thing. When they said that they'd have 70% kind of vaccinated by the end of June, I thought it'd be kind of in that last cohort almost to go through.
Instead, he, along with all Albertans over the age of 40, can book appointments for the AstraZeneca vaccine starting Tuesday. Alberta's premier made the announcement via Twitter. The decision is based on growing scientific knowledge about the vaccine and is based on the advice from Alberta's Chief Medical Officer of Health. Ontario was the first province to make the change, after Alberta, BC, and Manitoba followed too.
This is largely based on risk assessments, benefit risk assessments, and so if we look at the what we've learned more and more about the blood clot issue with AstraZeneca, how rare it is, and how what the risk of transmission of COVID is, the benefit far outweighs the risk.
Among the previously eligible age cohort of 55 to 64, there does appear to have been some hesitancy associated with the AstraZeneca vaccine. But this Ottawa family doctor says her patients are now clamoring to get whatever vaccine they can, particularly as infection numbers rise.
It was absolutely exciting to know that we would be able to immunize more of these younger patients. And also it was a bit frustrating that the decision was made that 40 would be the cutoff as opposed to younger groups, because like I said, we have many people who are in their 20s and 30s who are also forced to work outside the home.
Brent Cossey shares this frustration too, knowing his wife, who works as a teacher, is just a little too young to access the vaccine in Alberta right now. Heather, Yourex-West, Global News, Calgary.